Hello, and welcome back to our channel. Today, we're going to talk about a common yet often misunderstood illness, gastroenteritis, and I'm excited to guide you through this informative session. First things first, what exactly is gastroenteritis? Well, it's an inflammation of the stomach and intestines, typically caused by viral or bacterial infections. It's often referred to as the stomach flu or food poisoning. Now, let's dive into the symptoms you might experience if you have gastroenteritis. They can include the symptoms of gastroenteritis can vary in severity and may include a combination of gastrointestinal issues and general malaise. One of the hallmark symptoms of gastroenteritis is diarrhea, which is often watery and accompanied by frequent bowel movements. This can lead to dehydration if not properly managed. Dehydration can manifest as increased thirst, dry mouth, dark urine, and fatigue. It is important to replenish lost fluids by drinking water, oral rehydration solutions, or electrolyte-rich beverages. Nausea and vomiting are also common symptoms of gastroenteritis. These symptoms can be distressing and may lead to further dehydration. Individuals experiencing severe or persistent vomiting should seek medical attention to prevent complications. Stomach pain and cramps are another common feature of gastroenteritis. The abdominal discomfort may range from mild to severe and can be accompanied by bloating and gas. Eating bland foods, avoiding irritants, and using heating pads can help alleviate stomach pain. In some cases, individuals with gastroenteritis may experience fever, which is the body's natural response to infection. Fever can contribute to feelings of weakness, chills, and sweating. Over-the-counter medications like acetaminophen can help reduce fever and discomfort. Loss of appetite is a typical symptom of gastroenteritis as the digestive system is disrupted and food may be less appealing. It is important to listen to your body and consume small, easily digestible meals to provide necessary nutrients for recovery. Fatigue and weakness are common during gastroenteritis as the body expends energy to fight off the infection. Resting and allowing the body to recover is essential for a speedy recovery. In severe cases of gastroenteritis, symptoms such as bloody stools, persistent vomiting, high fever, and signs of severe dehydration such as dizziness, rapid heartbeat, and sunken eyes may indicate a need for urgent medical attention. Treatment for gastroenteritis symptoms. The treatment for gastroenteritis focuses on managing symptoms and preventing complications. It typically includes 1. Hydration. Replenishing lost fluids and electrolytes is crucial, especially in cases of diarrhea and vomiting. Oral rehydration solutions, clear fluids, and electrolyte-rich beverages can help maintain hydration levels. 2. Rest. Allowing the body to rest and recover is important during gastroenteritis. Adequate rest can help the immune system combat the infection and promote healing. 3. Medications. Over-the-counter medications like antidiarrheals and antiemetics may be used to alleviate symptoms such as diarrhea and vomiting. However, these should be used with caution and under medical guidance. 4. Dietary modifications. Following a bland diet that includes easily digestible foods like bananas, rice, applesauce, and toast. Brat diet. 5. Avoid irritants, spicy, fatty, or acidic foods. 6. Seek medical attention. In severe cases of gastroenteritis, or if symptoms persist or worsen, medical attention should be sought. Intravenous fluids, anti-nausea medications, and antibiotics may be prescribed depending on the underlying cause and severity of the condition. As they say, prevention is better than cure. Here are some tips to help prevent gastroenteritis. 1. Wash your hands frequently, especially before eating and after using the bathroom. 2. Practice proper food safety measures, such as cooking meats thoroughly and storing food at the correct temperature. 3. Avoid close contact with anyone who has gastroenteritis if possible. 4. Consider getting vaccinated against viruses like rotavirus, especially if you're at higher risk. By following these simple steps, you can reduce your risk of developing gastroenteritis. Well, that wraps up our discussion on gastroenteritis. Remember, if you're experiencing severe symptoms or have concerns about your health, don't hesitate to seek medical attention. Stay safe and healthy, and I'll see you in the next video. Don't forget to like, share, and subscribe for more health.